we are playing around with the LPN track. So if you look here, these are some lessons for the LPN. Let's click on the endocrine. Let's see, diabetes management. Let's peek at that. So you have the capability of printing. It doesn't look that pretty, but it will print. You can download it for offline use. You can have it read everything on here. Let's see if it's going to work for us. Oh, it's going through my ear set. It's reading it. So that's an option. But here's your content. Quick questions, conclusion, some key points, some pearls, mistakes to avoid, memory aids and mnemonics, and then a quiz at the end. I think each lesson has about 5 questions. Not every lesson will have a quiz, but most of them do. There's the quiz. Then we go back to the curriculum. And let's see if it marked it done for me. Oh, I guess there's a part 2. I'm not doing that. You get the gist of it. Actually, I do want to click on it because some of them have a video. And so what I did is I went to YouTube and found really good videos that would fit the scenario. Oh, you can also highlight. I am on a desktop, so it should work. It won't work on your mobile, I know that, but let's see. Like if you're like, oh, I like this, you can highlight that and then you can right click, right? And let me see. Or maybe I need to, let me bring it out and see if it does it. Yeah. So if I bring it out and see, you can highlight it purple and then you can add it to your notes page. So let me do that again. You can add a note. Let's see. It should be over here if I did it right. Yeah, so it went over here. So you can add highlights and notes or something you want to save for later. But let me go back to it. NurseLearn is best on your actual desktop. It's a lot more you can do than on your mobile. I will say, if you're gonna use it on your mobile, just use it for like practice questions to knock out a bunch of practice questions when you're waiting for an appointment or you're bored or something, got nothing better to do. Oh, did I pass it? But it's best to be done on a desktop. As you see, there's a lot more to it. But let's, the point of me clicking on this was to go to the video. If you see the little video button attached, then I found the good video for this lesson. And this is Level Up RN. So I like her content, so I added it in here. So it's kind of like I'm doing a research for you for videos that relates to the topic. Videos, I just don't have time. I am a full-time, well, I have my own clinic, so I'm a nurse practitioner and I see patients all day. But I love teaching, so that's why I started NurseLearn. One day I'll be able to make all my own videos on YouTube. So anyway, I'm gonna put this back down so you can kind of see what kind of look on your phone. So you will see this down here on your phone. AI Tutor. AI Tutor can be kind of funny acting sometimes. Let's see. She should kind of tell you how you're doing your content. As you see, I'm not doing that well. I've only completed 9 lessons. She's telling me to focus on the respiratory system. So let's see if I click this, if she's gonna explain it, the respiratory system to me. So yeah, gives a good concept. But the point of it is for you to be able to ask it anything. It's AI, so you can ask it anything. You can say, give me evidence-based guidelines on normal oxygen levels. see what you think. You encountered an error. Huh, why? That pisses me off. I'm gonna have to fix that. All right, I guess we'll go back here to the curriculum, or I can bring this out. I don't think you can do this on mobile, but I think it's because I'm on my computer. So let's see, clinical cases. So right now for the LPN, I've got about 7 cases in here. And you basically start the case. It'll take you a good 15, 20 minutes to go through the case. I really think that is helpful to kind of get you to thinking, getting you in the habit of actually taking care of a person. Let's see. I have no patience. All right, so it's giving you your overview. You're working on the med surg unit. You got a 58-year-old man. Post-op day 2, he had a right hemicolectomy, removing part of the large intestines for colon cancer. His wife called you into the room at 2:30. She says he seems off to me. He keeps saying he's cold, but he feels hot. You get your vitals. Woo, temp is 38.9. It was 37.4 this morning. Blood pressure 108 over 68. It was 130 over 80 earlier. Heart rate 105. Baseline 72. Respiration was 23. Oxygen 95% on 2 liter. He was 2 liters. He was 97%. Patient reports chills, increasing abdominal pain, rated 7 out of 10. It was 4 out of 10 this morning. He appears flushed and restless. You look at the surgical site, there's a midline abdominal incision with staples covered with the dressing. When you remove the dressing to assess, surrounding skin is erythematous, so red and warm, with a small amount of cloudy yellow discharge. This was not documented on the last assessment. Staple line is intact. Current orders: regular diet, D5.5, NS at 75 an hour, oxycodone 5 milligrams POQ 4 hours for pain, acetaminophen 650 POQ 6 hours for fever, and sinus barometer Q 1 hour while awake. Lab results this morning at 6, white count was 13.2, which is elevated. That's to be expected after a surgery though. Hemoglobin was 10.8, slightly low. Creatinine 1.1, which is normal. Mr. Okafar says, "Is this normal after surgery?" The other nurse said low-grade fevers are expected. So you completed your assessment. You need to decide what immediate action to take based on Mr. Okafar's condition and current symptoms. The vitals 38.9, blood pressure 108 over 68, heart rate 104, respirations 22, oxygen 95%. So what do you think that you need to do immediately? Do you need to administer the Tylenol and notify the RN of your findings? Position him flat and start cold compress to reduce the body temperature. Document the findings and wait for the next scheduled medication round. Provide emotional support and reassure Mr. Okafar that everything is normal after surgery. I'm going to go with this one. And what it'll do is it'll rate your response. One time I was like, I thought my response was better than you rated me. So it rated me at 85. What did you do well? Your choice to administer acetaminophen is appropriate within your scope of practice as an LPN. You recognize the need to address Mr. Okafar's elevated temperature, which is significant given his postoperative status and symptoms of chills, abdominal pain, and other vital signs. Clinical rationale. In this post-op setting, febrile responses can indicate complications such as infection, particularly with surgical patients. The increased temperature, elevated heart rate, and changes in abdominal pain could signify an evolving infection, possibly related to the surgical site. Acetaminophen will assist in managing fever, but assessment and clarification of the underlying cause are critical. Potential underlying cause. Areas of improvement. While it's good that you follow through with the administration of acetaminophen, it's crucial to emphasize that addressing the elevated temperature is essential, but you must also notify the RN immediately about the potential signs of infection, like the erythematous area around the surgical site and cloudy drainage, as this may require further clinical intervention. Your action to notify the RN is a necessary step to ensure comprehensive care for the patient. But that was when we read our options, it went away. That was the main option. And so to me, I think a score of 85, it should have been better than 85. I would say at least a 90 or 95 because the other options, the score would have been lower. So, patient's response. Following the Tylenol, Mr. Okafar may experience a reduction in fever and improvement in comfort levels initially. However, if an infectious process is present, his symptoms may persist, prompting the need to further evaluation and intervention from the RN and healthcare team. So, next phase. Did I click it? Okay. All right. Then, so after administering the Tylenol, his fever remains high and he continues to complain of abdominal pain. You receive a new order from the RN regarding pain management. Temperature 38.7, blood pressure 110/70, heart rate 106, respirations 20, oxygen 95%. So now what do? Because she's giving you an order regarding pain management. Administer the oxycodone, request a new order for pain medication from the physician immediately, increase IV fluids to D5NS to help hydration and urine output, perform a full set of vitals, and wait to reassess pain after 30 minutes. Well, what do you think? I'm going to go ahead and give the pain medication. Let's see what it says. 85%. But you did well. You correctly identified the need for pain management as Mr. Okafar's abdominal pain increased. Administering oxycodone as prescribed reflects appropriate knowledge of pain control protocols for post-op patients. Rationale: post-op patients experience pain. Managing effectively can promote comfort and aid in recovery. However, pain management should be balanced with monitoring for complications, including infection, especially when indicators suggest worsening condition, such as abdominal pain and fever. The patient's vital signs and surgical site assessment warrant closer observation and potential escalation of care to the RN. Areas of improvement. While your choice was appropriate for pain management, consider and monitor the patient closely for signs of developing infection, including elevated temperature, increased heart rate, changes in the surgical site. Additionally, ensure prompt communication with the RN regarding the concerning findings, including potential infection risk. So you did everything right. So the patient's response. After administering the oxycodone, Mr. Okafar may experience temporary relief from his pain, which could help him engage in postoperative activities like mobilization and deep breathing. However, if the underlying cause of his fever and abdominal pain potential infection is not addressed, the patient's condition may continue to deteriorate despite pain relief. So let's go to the next phase. I'm in too deep. I was gonna just show you this, but I'm in deep now. So we gotta keep going. All right. So you gave him the Tylenol, you gave him the Oxy. After administering the acetaminophen and the oxycodone, Mr. Okafar's fever initially drops to 37.8 and reports some relief in his abdominal pain, which is now a 5 out of 10. However, within an hour, the fever spikes back to 39.2. He becomes more restless, continues to express feelings of chills, which raises concerns for potential infection. The cloudy drainage at the surgical site increases, and erythema extends around the incision. His heart rate remains elevated at 108, and his blood pressure has dropped further to 100/66. So hopefully, the RN that you're working with has begun taking action with the surgery team to keep them updated on this. So they should already know about the fever from the first time. They should already know about the erythema because you expressed all that to her prior. At this point, the LPN needs to increase their assessment and data collection, focusing on vital signs, fluid status, pain levels, and response to interventions. The nurse should monitor the patient's temperature every 30 minutes and continue to evaluate the surgical site for any changes such as increased drainage, odor, or widening of the erythema. Hopefully, there was an outline of the erythema. Given the patient's sustained fever, elevated white blood count, and worsened abdominal symptoms despite symptomatic treatment, the LPN must recognize the potential for postoperative infection, such as an abscess or surgical site infection. It is critical to escalate the situation to the RN with updated findings, including any observed changes in vital signs, patient comfort, and increased wound drainage. The LPN may also prepare to assist with additional orders that could be initiated by the RN, such as a CBC, imaging studies, or IV antibiotics if indicated. This scenario serves as a learning opportunity for the LPN to enhance skills in observational assessment, critical thinking, and timely communication with the healthcare team. to ensure prompt interventions for a deteriorating post-surgical patient. New development. Increased drainage from the surgical site, extending erythema, persistent chills, and restlessness despite fever management. So now your vitals are 39.2, which is 102.5, blood pressure 100 over 66, heart rate 108, respirations 22, sats 95% on 2 liters. What's your next section? Are you going to assess the surgical site for any increased infection and report changes to the RN? Are you going to continue to monitor Mr. Okafar's vital signs every hour without intervention? Are you going to start a normal saline bolus to improve his blood pressure immediately? Are you going to reassure Mr. Okafar that the fever and pain are common after surgery and suggest relaxation techniques? I'm going to do this. Hey, let's see. It's out of order. 85 must be the best score. I want 100. I want like a 95 at least. So what did you do well? Your decision to assess the surgical site for signs of infection, report changes to the RN is appropriate and demonstrates a good understanding of your responsibilities as an LPN. You are adhering to the practice guidelines by focusing on patient monitoring and collaborating with the RN for further actions. Clinical rationale. Assessing the surgical site for increased infection is crucial after observing changes such as increased erythema, warmth, and cloudy drainage. This can be signs of infection, and timely reporting is essential to for patient safety and preventing complications. Early identification for potential wound infections allows for prompt intervention, which is critical in post-op patient care. Areas of improvement. We don't need no improvement. We were doing great. While assessing the surgical site was the correct choice, it would also be important to immediately document the findings and any pertinent changes, such as patient's new symptoms and vital signs before reporting to the RN. I didn't see that as an option. Patient's response. Based on your choice, if an assessment reveals worsening symptoms, the patient may experience more significant pain, elevated fever, and potential systemic signs of infection, such as increased heart rate or changes in the blood pressure. This could lead to a need for different interventions, including possible IV antibiotics or further imaging if an abscess or other complication is suspected. So let's go on to the next phase. We are invested. These cases take a while. All right, phase 4. After reporting your findings to the RN, she instructs you to assist with further evaluations. They suggest calling a physician for potential intervention. You need to clarify what needs to be done next. Temp 39.2, the blood pressure is dropping. Blood pressure is 95 over 60. Heart rate is 112. Respirations is 24. Oxygen is 93%. All right, do you document the findings and prepare for another acetaminophen administration? Prepare Mr. Okafar for a potential transfer to a higher level of care based on the RN guidance and physician's orders. Suggest to the RN that Mr. Okafar should remain on a regular diet despite his worsening conditioning. Inform the RN that you can manage Mr. Okafar's care independently without additional physician orders. Well, you know that's not true. And I wouldn't have this guy eating if he's getting worse, because what if he's going to need to go back to the OR? So A and B is going to be your possible answers. And all it says is the RN instructs you to assist with further evaluations. I'm going to go with B, but that's hard because I'm thinking as an NP brain. Let's see. It could be A. But I think 85 is the best score. All right, so we said do a potential transfer. Following your choice, it's likely that Mr. Okafar may experience a brief stabilization if adequate interventions are performed promptly post-transfer. However, without proper treatment for his signs of infection, his condition could further deteriorate due to potential sepsis or other complications. Yeah, this guy's going down here. Heart rate is up, blood pressure is down, respirations is up, oxygen's down, temperature is up. What you did well. Your decision to prepare Mr. Okafar for a potential transfer is to a higher level of care shows clinical judgment. You recognize the worsening signs of infection, such as the elevated temperature, increased abdominal pain, and the evidence of possible surgical site infection. Given Mr. Okafar's elevated vital signs and symptoms, sorry, given Mr. Okafar's elevated vital signs and symptoms suggestive of an infection or complication from surgery, transferring to a higher level of care is appropriate. The RN or physician must be informed to potentially order further diagnostic tests or treatment. Immediate interventions like IV fluids, antibiotics, or other medications will typically be managed at a higher level of care. This guy might either go to step down or ICU. Definitely at least tele. Areas of improvement. While your actions align with LPN scope under RN supervision, it's important to ensure the RN is fully informed regarding Mr. Okafar's condition. Also, further detailed assessment of his symptoms could enhance decision making toward patient safety. You could consider initiating more frequent monitoring in case of further deterioration before the transfer. Patient response. Following your choice, it's likely that Mr. Okafar experienced a brief stabilization if adequate interventions are performed promptly post transfer. However, without proper treatment for his signs of infection, his condition could further deteriorate due to potential sepsis or other complications related to his surgery. So we got excellent. All right. So 85 is good. All right. I've always played around with these case studies, but I never had the patience to go through it. But I'm like, oh, I'm invested today. So 85% earn 50 points. Excellent. So that's some cases there. I was supposed to just run through this with you, but I was invested. So you got 4 exams on here. 1, 2, 3, 4. Yeah. So you got one the first one you kind of do before you start messing around with NurseLearn. Then you got a midpoint, and then you got a final practice, and then you got like an extended one. So if you see a 75 questions, 100 questions, 75, and then 145 questions. So and these are full exams like timed. See how it's 90 minutes, 120 minutes, 90 minutes, and 180 minutes. So the clock will be ticking. These are some cheat sheets I've got uploaded here. And I have downloaded. You can make your own cheat sheets in here. I'll show you how, but I did download so you can kind of see how it looks. So this one is RA and OA. Now, wanted to make your own, there's a cheat sheet generator. Is it as pretty? No. Um, let's see. It doesn't have all the cute pictures like the one that I made. How to insert an intravenous catheter. And you really want to be specific. Please also help me understand the different IV sizes. Let's see if we get it, especially since I abbreviated. But you want to be as specific as possible. See how this says beta blockers for heart failure works better than just heart meds. So, or add additional notes, focus on pediatric dosing, including nursing interventions. So let's see. Let me put placement. Actually, let me put inserting an IV. What the heck did I do? Let's see if let me call it its name. Sometimes when you're messing with AI, you got to be really specific. Let's see. But it'll give you a cheat sheet. Like I said, it's not as cute. So here's your cheat sheet. It's actually what cheat sheets should be, straight to the point. But me, I like to be a little over the top. Let's see if I saved it. It saved it somewhere. Where did I save it at? Ah, should have copied it. It saves it somewhere in here. I don't think it downloaded it. No, it saves it somewhere in here. I'm moving on. Yeah, I know it saves it. Study planner. So with this, you basically set your exam date and they'll create like a study plan for you. So let's say you're gonna May 4th. So to kind of tell you 36 days, how many lessons do you need to complete, and basically you need to do 3.8 lessons a day. All right. Study calendar. So 36 days, 57 tasks. I've completed 0 so far. And early signs of patient deterioration. So you should be able to click on there and it goes to it for you. Sometimes it acts a little funky, but it should go to the lesson for you. That was the point of that. Let's see if it does it right. I'm trying to create these things to make it interactive and fun, but sometimes I screw it up. If you have any problems while you're in here, always just let me know. You can send me a DM in social media, or you can email me at support@nurselearn.co. It's .co.co, because there is a nurselearn.com. And so sometimes people think that we are nurselearn.com, we're nurselearn.co. All right, I don't have patience for this. Let's go. Is it NurseLearn acting up or is my computer moving too slow? All right, I don't have patience for this. I'm gonna get more. I just realized I didn't really. I like the cheat sheets better. Um, This is helpful though, especially if you're working in like critical care. Oh, this is separate. It should have separated out for you. Like you shouldn't even be seeing this one for the RN or NP. I'm not gonna take it out. Just know that I mean, I'm always a believer in learning way more than you need to. Just know as an LPN, this is not something you would worry about. But it's nice to know when you're working with your RN or your NP. Oh, especially if you already know, oh, this patient's acidotic, or this patient is having metabolic alkalosis or something like that. This is your question bank. So this is the one I was saying do on your phone because to me it'd be easier that way. Otherwise, all this other, I would do it if I'm on a computer. And these are some quizzes if you'd rather do a quiz instead of a question bank. Let's see if the flashcards are working today. Okay, seems like it is. It gives me a hard time sometimes. What are the key components of a female reproductive health system? Sorry, damn, health assessment. History, cycle details, physical exams, any STIs, menstrual disorders, previous pregnancies, vital signs, pap smears, signs of infections, changes in health, discussing contraceptions, STDs, prevention, and importance of regular checkups. I'm looking for one where I can just give one answer. Oh, yeah, I'm not going to be listening to all that. That's why I like multiple choice questions. I hear now that the NCLEX has changed and it's not just multiple choice. What I've always hated was that select all that apply. I'm like, you guys are stressing me out because if you miss one, you just missed the whole question. But I hear in the NCLEX, it'll give you points though. It's different than getting the whole question wrong. It'll give you partial credit, is what I've heard. Group study. I don't have anybody in a group right now, but you can create groups with others. What you would have to do is create a study group and you can call it LPN of Arizona or something. I'm in Arizona. So, hey, Arizona LPNs, let's study together. And you can put your schedule, maybe Wednesdays at 8 p.m. You can make this public, but if you create your group, so there's your group. And so this code is what you would share with somebody. So if you got a code, they would give you that code and you can join their group with that code. Oops, I didn't mean to do that. But you can share study pack, group quizzes, challenge each other, notes. I'll go to leaderboards. So have you ever heard of like a study pack? This one's not as pretty as I like it, but it's decent. Let's click pharmacology. So study pack for you. It says visual aids, but to me, it doesn't really do good visual aids. And so this is how it looks. And you can download it or you can share it with your group. See, I know it could be because I'm screen recording. Oh, I'm like, where's my stuff going? So this is how it looks. Like I said, it's okay. But I like mine. See how it's got a couple errors? I'm glad it's telling me the correct answer, but you could have just highlighted it. You didn't have to put that in here. I like my guides and everything I create I use Gamma to create a lot of my guides and cheat sheets. But yeah, so that's the study pack. It tells you some lessons that are related, NurseLearn lessons. So I love it. I'm not complaining. I just wish it was prettier. I guess beggars can't be choosy, huh? So let's see what's next. Messages. If you need to message me, well, hi, cheat sheet generator is not working. You can send me that message. There's your AI tutor. It was acting stupid earlier. Let's see. That's about levels. Yeah, so something I need to work on. There's a board exam guide. So kind of help you understand what to expect. Depends on what state. Some states do LPN, some have LVN, which is so you got your licensed practical nurse and your licensed vocational nurse. Pretty interchangeable. If you move to a new state, you should be able to just get updated licensing. You shouldn't have to do anything different unless you haven't been practicing. Got some comment boards here, or you can also go to the 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 national NCSBN. Talks about costs, give you some study tips, nursing support, same thing if you need to message us. We do have an affiliate program. So whichever one somebody signs up for will give you some cash. So if somebody picked the 1 month plan, you get 980, 2 month plan, you get 1580, 3 month plan, you get 1980. So that's a pretty good commission. What's that, like 20%? There's my code, and you choose your payout method. And then this is some marketing. So some social media posts, LinkedIn, email templates if you ever want to email somebody. And then it'll create some images for you. They're okay. they're they're okay. It gets the job done. I'm not gonna complain because it's not like I mean I guess I could upload my own images. I can upload my own images, but it'll give you some study smarter, pass faster. Yeah. Or you can feel free to use some screenshots while you're in here doing things to share the content. Share your success story. If you want to submit a review for us. Oh gosh, sorry. One day he walked into town. Stop. My phone is these phones is crazy. They be listening. Career Corner. So it kind of shows you what to expect. And this is averages. Some states will make more, some states will make less. And then there's humor, some corny jokes. How did the LPN handle a different patient? She just kept reminding herself they're not mad at me, they're mad at their IV. So just corny stuff. Some memes, some quotes. It's tough being a nurse and definitely tougher being a student. So I'm designing this to kind of help you. Sometimes you need to come in and read. I can't keep calm. I'm an LPN on caffeine and chaos. Sometimes you need to read that. You know, I may not have RN behind my name, but I have a PhD in patient care and patients. Boom, I love it. Relaxation. Relaxing is really important as a nurse because work can be really stressful, especially if you're either working 12-hour shifts or if you're working in like a SNF where you got 30 patients. You need to relax. So we created this little relaxation corner, just kind of got some exercises. You got your shoulder rolls, you got your box breathing, and then a little YouTube video for a little meditation. And then some motivation, so some daily affirmations for you, some words of wisdom. You're not just studying to pass tests, you are training to become a guardian of health and healing. All right. Being a nurse is the one of the most rewarding careers that I feel like it sometimes when you're doing it, but to know that you're making a difference in somebody's life, to me, that is quite amazing. All right. In this video, I don't know why it's available, but I'll get that fixed. So I see two things I gotta fix. The AI tutor in that video. But that's basically NurseLearn in a nutshell. Okay. Oh, we already went through clinical cases. All right. Thank you so much for watching. If you have any questions, my name is Angie, the founder and creator of NurseLearn. I'm pretty proud of what I've created, and I'm always striving to do better. So if you have any suggestions, let me know. I can't say I'll be doing a lot of lives. I'm just so busy. I would love to, but sometimes when I get home, 7, 8 o'clock at night, I need to focus on getting ready for the next day. It's not fun, but maybe I'll start doing some lives on weekends. One time I went live on a Saturday and nobody was on my live. I'm like, oh, I guess y'all trying to enjoy your day, but I know people are more on live during the week and the evenings, which makes sense. Why would you need to be posted up on social media on a Saturday night? You should be having fun, enjoying your family, enjoying your friends. But I will try to be on live more. Also know that I use AI a lot because I'm busy, but know the content that you're getting is good quality content. It's not crap. Sometimes people comment on my videos, oh, I can't deal with this AI. I love AI because it can be my assistant and create some things that I just don't have time to create. And of course, every video I post, everything I do, I watch the video, every content that I have is content that I agree with and that I created. So it's still me. It's just my assistant helping me. All right, talk to you guys next time. NurseLearn.co.